Standard 4.4 requires CoC-accredited cancer programs to achieve and maintain performance levels for specified accountability measures. Clinical trials data is used to validate an accountability measure as a standard of care. The Cancer Committee reviews the quality of patient care by using the CoC quality reporting tools, such as Cancer Program Practice Profile Reports, also called CP3R. The measures are very specific to diagnosis and treatment. Cancer Committee addresses performance levels that fall below specified levels through an action plan that includes follow-up. Cancer Committee minutes document this activity at least annually. This standard is important for internal monitoring of quality cancer care based on CoC-required measures. The involvement of a multidisciplinary cancer committee in discussing these measures and their performance rates is essential. In meeting this standard, the CTR, Quality Improvement Coordinator, and the Cancer Liaison Physician, or CLP, whose responsibility includes reporting quarterly on the National Cancer Database, or NCDB, data for the program, will be important contributors. CoC updates and releases the review and assessment schedule yearly. Each year, the performance rates for each accountability measure are reviewed using the CoC quality reporting tools. Additionally, the performance rates for accountability measures selected by CoC must meet or exceed the specified percentages. Finally, an activity report outlining the measures, performance levels, and any action plans to remedy levels under the required thresholds is documented in the Cancer Committee minutes. Documentation begins with completing the SAR. The CoC assigns a provisional rating at that time based on current data. The surveyor will review Cancer Committee minutes, which will demonstrate the review and monitoring of patient care by use of the CoC reporting tools, the reporting to Cancer Committee annually, and any action plans implemented. Validation of data is done by the surveyor with a review of selected analytic cases. When the surveyor reviews medical records and registry data during survey, a provisional rating can be revised. Best practices for meeting the standard include the CTR regularly monitoring compliance percentages so that after the single submission per year, updating can be done to achieve compliance. Because the CLP is required to report on NCDB data 4 times yearly to Cancer Committee, the opportunity to discuss these accountability measures should be an agenda item at each quarterly meeting. Utilizing the RQRS system can illustrate how treatment guidelines can be met in real time, avoiding below-average performance levels. Refer to CoC website for specifics about performance rates. Thank you for viewing this video on the CoC standards, and remember to view the remaining videos in this series to further increase your knowledge on the standards. For additional resources, be sure to visit the CoC website at www.facs.org/cancer to access the CoC Educational Portal, Best Practices Repository, and Cancer Forum.